So my name is Matt Arnett. I'm the Director of Outpatient Services for KVC Kansas. Outpatient services at KVC Kansas really started as a way to provide therapy services for kids and families in their homes and communities. Most of the work that we do is in-home or in community. We don't want the burden of families having to figure out ways to get here, find transportation. And so in addition to that, we also provide medication for families and kids who really need that to help support the changes that they're making, help manage behavior and mood. And then the last piece that really makes up the pillars of what we do is assessment. So we use a variety of assessments to help us identify what to work on and then what to help kids and families with for sustained change over time. One thing that we're able to do in our outpatient services, because we're a little bit more flexible than maybe other providers in the area, is that we can maybe start by working with a youth individually one-on-one to help them manage their mood or behavior. And then we teach skills to their foster parents, relatives, kinship caregivers, and then finally bridge that over to the biological parents. So I have a case that I worked on a number of years ago where that's really the way that it progressed. We started by helping give some tools to the child, give them a voice, give them a sense of empowerment that they could say what they need. And then we helped teach those skills to the foster family so that while they were living with them, they were able to help promote them to use the skills to calm down, or if they really needed something, they felt comfortable going to that caregiver. And then as we moved towards moving that child back home, we then shifted the focus to then the biological family and that child. And so they then partnered with the foster family and then me as the therapist to help bridge that gap. And so those kind of situations happen all the time in our services, and something that maybe you don't necessarily get from other providers who aren't so locked into the systems of care here at KVC Kansas. So with other people who do similar work to KVC, they don't necessarily have this kind of a resource built out as robustly as we have here at KVC. And because we really are able to focus on a smaller number of clients, we really can provide a lot more treatment, advocacy, a lot more focus on the changing needs of kids and families as they move their way through child welfare services. So that really is something that's unique, I think, about KVC Kansas. One of the nice things about having outpatient services within KVC is that we've really been able to be the center point for mental health treatment for our kids and families. It's not necessarily something you're going to get with other similar types of behavioral health providers in the area. We really are able to maybe start by working individually with a child or family and then build that out to other touch points they have in the community, whether that's a school, faith community, the court system that we work with. And while we started out smaller, we've been able to grow as the needs of our kids and families have grown over time. And we've built on different aspects of behavioral health treatment, like addiction services, medication management services, assessment services, as we've seen those needs come up and as we've seen barriers created in the community to accessing those types of services.